everybody, I'm Shayna, and I'm doing a little series on what we nurses or your provider, doctor or midwife, check for when we're doing a vaginal exam when you're in labor. So I talked about the first thing, which was dilation. You can go back and watch my video from a few posts ago. And now this video is about effacement. So that's the second thing that we assess for during a vaginal exam. Effacement is the thickness of your cervix. So on a scale of 0 to 100%, we're assessing, measuring, feeling how thick your cervix is. So I have my handy dandy assistant here, my baby. So pretend baby's head down, right, in the uterus. And when we go in to do our exam, go in with our fingers, glove on, of course, and we're looking for this little hole. And we're feeling for dilation. So I would find the hole with my fingers. Oh, that's about 3 centimeters dilated. And I'm feeling for the thickness. So this would feel, I can feel against the tip of my finger how thick that is. Because as the cervix opens, it gets more and more thinned out. So you can kind of see it's all bunched up at the beginning when it's not as dilated. Then as the cervix opens, as each contraction pushes baby's head down against the cervix, it's stretching and it's thinning. That just naturally happens as something is being stretched out. It's thinning out, right? So another little example I have, this is a little toy from my kid's toy box. I can feel against the side of my finger how thick that is. Look at that. I would say that's not very effaced at all. It's maybe 25% effaced, or we would just say thick. And then 100% effaced would be paper thin. You hardly feel that it's there. And we can just tell that by feeling against our finger. It's just another way that we can assess how labor is progressing. We like to know that your cervix is dilating and also thinning out. Having a completely dilated and completely effaced cervix shows that you are ready to have your baby, because we want you to be 10 centimeters dilated, 100% effaced. And then the next thing, stay tuned for the third thing that we assess for in a vaginal exam. Thanks for watching.